Hi, Miss Opal. I'm Lauren Peak, and I'm going to be doing a head-to-toe assessment on you today. I'll let you know everything when I start doing it. I'm going to be checking your neurological status, your head and your neck, your respiratory, cardiac system, your abdomen, and I'm going to be checking your gait and the way you stand and your muscle tone. And then I'm going to be checking your skin and your pulses. Do you have any questions before we start?
No, ma'am.
Okay, so the first thing I'm going to do is I'm going to check your level of consciousness, which can you tell me your name and your date of birth and where you are?
Opal Pritchett. My birthday is 9/26/1959. I'm at the hospital in Clarksville.
Okay, and what are we doing today?
A full assessment.
Okay, and next I'm going to be checking your cranial nerves, which are the nerves in your brain.
Okay.
The first one we're going to be checking is your cranial nerve 1, and it's to check your olfactory. So I'm going to get an alcohol pad out of my pocket, and if you could close your eyes, I'm going to see if you could smell it whenever I get it close to your nose.
Or not?
It doesn't matter.
Okay.
Can you
Yes, I can smell it.
Okay. And then I'll ask you to put your finger on one nostril like this.
With eyes closed?
No, it doesn't matter.
Okay.
Just can you breathe good out of both nostrils?
Yes, ma'am.
Okay, so no problems with smelling or anything like that?
No, ma'am.
Okay. The next nerve we're going to check is your optic nerve. You can wear your glasses during this test, and I'm going to ask you to stand right over here.
Okay.
And if you could cover one eye for me, read the lowest line on that chart for me.
Okay. Line 7. FELOPZD.
Okay, can you read 8 at all?
Yes. DEFPOTEC.
Good, you got them all right. Okay, cover the other eye and do the same thing for me.
Okay, that's going to be line 9. LEFODPCT.
Okay, great. Okay, you can get back up on the bed now. And while you were standing up, I could see that you can stand up and move around all by yourself without any assistance, so that's good. Okay, I'm going to use my pen, and I'm going to bring the pen close to your nose, and you cross your eyes as you look at it, okay?
Okay.
Okay, good. And I'm going to bring it from this side and follow it with your eyes. Okay, now I'm going to bring it from this side and do the same thing. Okay, good. Alright, now we're going to check your cranial nerve 3, 4, and 6, which is, that's going to be the way that your pupils restrict and they react to light, so I'm going to need you to take your glasses off for that one. I'm just going to shine this light from the outer to the inner part towards your nose and just look forward at me.
Okay.
Okay, your pupils restricted good to that, which is a good sign. And then I'm also going to get you to cross your eyes without your glasses on. Just follow my finger. Okay, good. You can put your glasses back on now. Okay, from this far away, which is approximately 20 feet away, can you see this Sharpie well? Can you read what it says?
Yes, it says Sharpie.
Okay, and I'm going to bring it further toward you. Can you see it just as well as you could out farther away?
Yes.
Okay. All those nerves are looking great. So the next one we're going to look at is cranial nerve 5, which is your trigeminal nerve. I'm going to have you close both of your eyes, and I'm going to touch the side of your face. Or actually, I'm going to have you open your eyes, I'm sorry.
Okay.
I'm going to touch the side of your face, and which that was a good test because your eyes shut right when I touched the side of your face. So that means you have good reflexes for your trigeminal nerve. Could you feel that my finger was soft?
Yes.
Okay. I'm going to stick you with just the pokey part of this paper.
Okay.
And could you feel that that was sharp?
Yes.
Okay, good. Okay, the next one we're going to look at is your cranial nerve 7, and I just need you to smile for me. I'm checking to see if your face is symmetrical, and it is. Also need you to shut your eyes really tight. Okay, good. And I don't see any drooping or anything when you do that, so that's great. The next one is cranial nerve 8, which is your hearing. Do you have any problems with hearing? Wear any hearing aids or anything like that? Okay. I'm going to rub one of my fingers like this by your ear, and you tell me which one you can hear, okay?
This one.
Okay, good. All right, moving on to 9 and 10. That checks your glossopharyngeal nerve, which is from your voice, and you don't have a hoarse or nasal voice at all. How is your swallowing? You have any problems with that?
No problems.
Okay. This test would get me to, or I would need to check your gag reflexes, but I'm not going to do that in this test because I don't want to stick anything in your throat. You do have a good gag reflex. Okay.
Yes.
All right. The next one's going to be your cranial nerve 11, which is your accessory muscles. Can you move your shoulders up and down for me? Okay, great. And then the last one is your hypoglossal cranial nerve 12. And I just need to look at your tongue, and you can stick it out good. Okay, so that's great. Okay. And I'm gonna check your vital signs.
You want me sitting or laying?
Sitting is fine.
Okay.
I don't have a blood pressure cuff in the room with me at this time, but we checked it before the test, and it was 136/78. And her pulse was 64. Her temperature is 98.2. And she's breathing at 20 respirations per minute. Okay, so now I'm going to check your head and your neck. I'm going to palpate your lymph nodes on this side. My hands might be a little cold. Okay. And then we checked your near and your far vision on the vision chart. And I'm going to just look at your pupils now. They're even, they're reactive to light, and they're round. Your ears, the external part of your ears look good. No signs of anything on them. And then, you have a sore throat or anything like that? Okay, could you look at me real straight? I was checking to see if your trachea is symmetrical, and it is. Alright, so now I'm going to listen to your lungs.
Okay.
You have 26 regions in your lungs, so I'm going to listen to 26 places.
Okay.
I'm going to slide my stethoscope up your shirt. Right now I'm listening to the 10 areas on the posterior region of your back. And your lung sounds are clear in the upper regions. Take a deep breath for me. Just be careful not to hyperventilate. Okay, your lungs sound great. I'm just going to ask you to raise your right arm up for me while I'm on this side. And I'm going to be checking 4 of your regions over here. Deep breath for me. Okay, I'm going to be checking the same 10 areas on your anterior front of your chest as I did the back.
Okay.
All your lung sounds sound really clear. Walk over to the side, and we're going to get you to raise your arm up on this side, and I'm going to check them just as I did on the right side. Those are sounding great. All of your lungs fields are clear. Respirations are even. Okay, so now I'm going to move on. I'm going to listen to your heart. I'm going to listen to it in 4 places.
Okay.
You can just breathe normally. Heart sounds great. I'm going to get you to lay back for me, and I'm going to be looking at your tummy. First, I'm going to listen to it and see if you have active bowel sounds. I'm just going to put my stethoscope under your shirt. Bowel sounds are very active. When is the last time that you had a bowel movement?
Yesterday.
Okay. And now I'm going to be feeling for some structures under your stomach. I'm going to be first lightly touching on your stomach, and then I'm going to touch a little harder on them. So right now I'm feeling, I'm going to be feeling for your spleen. I'm going to press a little harder now. Okay, I'm going to feel of your liver on this side. Okay, could I get you to sit up now for me?
Mhm.
Sorry.
No, you're fine.
And then I'm just going to be feeling on your back. Does that hurt anywhere?
No.
Did it hurt anywhere when I was touching on the front of your stomach?
No.
And right now I'm palpating her kidneys. Okay. All right, and just a minute ago I was watching you and you have good muscle strength. Do you have any problems with, have you had any frequent falls? You've fallen
No.
lately or anything like that? Okay. Do you exercise regularly?
Yes.
Okay. You have any problems with your skin? Any lesions on your skin or anything like that? Okay, while I'm looking at your legs, I'm just going to check your pulses on your feet.
Okay.
Okay, good strong pulse on that one. Good strong pulse on that one too. I'm just going to check right back here for a pulse. Good circulation in your feet. Okay, and then I'm going to check your hands too. Okay. Alright, do you have any questions for me?
No, ma'am.
Okay, when I was looking at your feet, I noticed you didn't have any swelling or anything, so that's great. Looks like you're doing good today.
All right, thank you.
Thank you very much. You have any questions for me?
No, ma'am, I'm fine. Thank you.
Okay.
You did a great job.